and welcome to BERNAMA World. I'm PASHA RAHIM. Suicide remains a pressing public health issue, and the way it is reported can significantly impact society. The Content Forum has launched a nationwide public consultation to establish ethical guidelines for reporting and sharing suicide-related content. Now, these guidelines aim to prevent harmful effects while ensuring accurate and also sensitive coverage. Today we speak with MEDIHA MAHMOOD, CEO of Communications and Multimedia Content Forum of Malaysia, and also Professor Dr. Chan Lai Fong, Professor of Psychiatry and Senior Consultant Psychiatrist from the Faculty of Medicine and Hospital Chancellor Tuanku Muhriz at UKM, to discuss the importance of these guidelines, their impact, and how the media and public can contribute to responsible reporting. Welcome to the show, ladies. Thank you for being with us today.
Thank you for having us.
First of all, let's talk about the need for these ethical guidelines, right? Here's a question for you both to answer. Maybe we'll start with you, MEDIHA, first. What are the key concerns that has led to the development of these guidelines for ethical suicide reporting?
I think for us, it all began during the pandemic. Let's just go back there, because in 2021, we conducted a nationwide public consultation to improve our content code. And in the content code, it's best practices, content standards, etc. That's when we were first given input from not just the public, but also mental health practitioners, that during that time, suicide cases were on the rise, and the way suicide cases were being reported was unsafe. And that's why we realized, and we did some research and discovered that across the world, that's the whole point of suicide reporting. When it is unsafe, it actually can lead to harm in real life. And so we decided that we didn't know about it. A lot of people out there who are not just media journalists, content creators as well, had no idea that this can lead to, for lack of a better term, copycat suicides and things like that, and unsafe reporting. So we've included it in the content code.
Right.
However, the reason why we develop these guidelines now is because content is not just being given by media practitioners. We've got content creators, influencers, everyone who's producing content, and everyone with a phone can report it. So everybody needs to know what these are.
Okay, for Prof, your point of view.
Yeah, so just to echo what MEDIHA just said, there is that risk of, we use the layman term copycat suicides, or we can use the more technical term as in suicide contagion to happen, whereby the risk of suicide for people who may have other risk factors for suicide to be elevated some more if they're exposed to unsafe reporting of suicide related content in the media, online, whatever is accessible.
Okay, let's talk a little bit more about suicide contagion, or like you said in layman terms, copycat suicide. Maybe you'd like to elaborate a little bit more on that. Prof.
Sure. So how I like to explain it is by actually drawing the analogy from a biological contagion. For example, we are all familiar with the COVID-19, and it is biologically contagious as in it can spread through droplet infection. Whereas when we're talking about a social contagion, like when news or media that's reporting about suicide is not done properly or in a safe manner, it actually may lead to other people who are at risk for suicide to copy the behavior, the suicidal behavior. And the term that we use is called Werther effect. And if anybody's familiar with the 18th century poet and writer by the name of Goethe, he wrote a very popular book called The Sorrows of Werther, whereby the hero in the book actually took his own life after a traumatic life event. And unfortunately, after the book was published, there were a spate of suicides that were done in a similar manner, similar method, and affecting a young man in the social demographic profile of the hero in the book, Sorrows of a Young Werther. So that's where the term Werther effect or copycat effect or suicide contagion has come about, whereby the behavior is modeled or learned from actually watching or consuming media or the news.
Right, so it somehow inadvertently becomes some sort of a manual book for people to attempt suicide. Now, you also mentioned people who are at risk of suicide. Maybe just to give us a clearer picture, who are these people who are at risk of suicide?
Okay, so we talk about what are the risk factors and what are the protective factors of suicide, because technically speaking, it will be very difficult to actually predict who will actually die by suicide at a particular time.
Right.
But we know that risk factors, like if you've got a family history of suicide, if you've got a major psychiatric illness, or if you had previously attempted suicide before, and things like substance abuse, whether it's drugs or alcohol, that heightens a person's risk to suicide. So if there is that whole factors in the bag, and that on top of that there's also the suicide contagion happening by the person who consumes media, then that person's risk for dying by suicide actually goes up.
Okay, MEDIHA, from a content regulation perspective, right, how do you balance press freedom and also the need for responsible reporting? Because everybody is about freedom of expression, and freedom of this and freedom of that, but you know, we always say the same thing, with certain freedoms comes responsibility. So
you're absolutely right. I think every freedom has its limitations, and we always say that your freedom ends where harm to others begins. So this is the same thing with reporting on suicide cases. What do you get from reporting the suicide or having content on suicide? The ultimate objective should be prevention of suicide. That's the entire aim. If you provide details to the method, to the wheres and hows and whys, how does that contribute to society? How does that inform society, other than inflicting harm on people who are already, you know, predisposed or maybe even thinking of dying by suicide? So freedom of press, freedom of speech, we're all for that, but if it leads to harm against people, even the risk of harm against people, there needs to be some limitations to that.
Okay, how important is it to report a death by suicide? Is it enough for us just to report the death, period, or must there be, you know, this person so and so has died due to suicide? Like, is it a piece of information that we can leave out, or no?
I guess in certain countries they don't even report suicide news anymore. In Malaysia, suicide is no longer a criminal offence, so it's not really reporting crime either. And we always say, if you're going to report it, it is for the purpose of prevention of suicide. So if you're going to report it, you must make sure that helplines are there. You talk about how suicide is preventable. You talk about whatever support that there is for people who are survivors of these situations or who are potentially thinking of it. So whenever we report news, the necessity for it, we're not going to dictate to the press how they do this. We're only saying is, what is the value that you bring with this piece of news? If it's suicide prevention, go ahead. But if it's just to appease the morbid curiosity of people, then probably not.
So for as long as we're not sensationalizing death due to suicide, then it should be fair for us to report deaths caused by suicide. Prof, how does media coverage influence public attitudes and behaviors towards suicide? Now, we've talked about how, you know, reporting suicides can cause copycat suicides. Let's talk about people who are consuming these news from that angle. If there's any research, what does this research say about the impacts of this?
Right, so we've talked about the negative impact of how media can portray suicide, which is not in a helpful manner. I think what I would like to highlight actually is that the role that media can play in suicide prevention is really huge.
Okay.
So we talked about Werther effect as in suicide contagion, copycat. That's not what we want. But what we want is, the term is called Papageno effect, protective effect against suicide. So how the term Papageno came about is that this particular researcher, Thomas Niederkrotenthaler in Austria, actually found through their research that if there are, like what MEDIHA mentioned, there are helplines and resources on how to seek help published in relation to a suicide-related content being published, then there is a chance that people who might be at risk know how to seek help if they are, for whatever reason, triggered or feel uncomfortable or emotionally distressed. So that is what we mean by Papageno effect. The other very important thing to actually highlight is that what we want to share is the narrative of recovery and hope. So if people are in a suicidal crisis, which happens, and how the person actually copes and overcome the suicidal crisis, that's what we want people in similar situations to copy, so-called copy or learn, rather than the method of a lethal way of suicide. So that's actually the positive role that media can play in suicide prevention.
Okay, speaking about the role of media, let's talk about the scope and also the implementation of these guidelines, right? So these guidelines cover various aspects. We're talking about social media, especially these days, to reporting on celebrity suicides, and these get a lot of attention from the public. What are the most critical elements media professionals should adopt?
I think we've all talked about it. The main thing is for media to understand why we're making this a guideline, why it's necessary for us to have these rules in the first place. And I think Dr. Chan has explained it all there. I feel that whatever, because we live in a multi-faith community as well, talking about suicide has its own taboos and risk as well. So we're trying to make sure that we can have these conversations in a safe manner, age appropriate as well, because our main objective is to prevent such a situation from happening. And I feel that, like Dr. Chan said as well, media plays a very important role in this, and these guidelines can assist media to then become an example for the content creators out there as well, because we're not just talking about media professionals who are already trained with ethics and professional journalism and all that, right? We've got mojos, mobile journalists, we've got people who take on the role as journalists, as content creators or influencers, and we want them to abide by the same standards. So hopefully this is a way for us to get that widespread.
Prof, anything to add on to that?
Yes, I would like to add on the take on celebrity suicide. So it is especially important to report celebrity suicides in a safe manner. Not just what not to say, but the whole narrative that follows the particular story. For example, we know that celebrities are like, people idolize them and they look up to them. So if the suicide of a particular celebrity has been glamorized, sensationalized, that is really a big no-no, because so many people are looking up to these celebrities, and if they over-identify with whatever aspect of reason that they died by suicide, the psychology behind it is that if a person of that stature and who has so many things in this world that I aspire to be feels that life is meaningless and hopeless, what about me when I'm facing a difficult situation? So that is not what we want the readers to consume or to draw a narrative from, but we would rather them draw hope from a story of recovery. How can I actually heal? How can I actually recover? Now that's a positive thing that can be shared widely.
Right. So having guidelines alone are not enough. Like, obviously we need to have implementation, and media professionals alike, social media influencers, like you mentioned, need to follow these guidelines as well. We are going to get back on that, but we're going to go for a very, very quick break, and we'll be right back. Don't go anywhere.
Ketahui tips keselamatan elektrik di musim banjir. Sebelum menghadapi banjir, tutup suis kelengkapan elektrik dan diikuti suis utama. Pindahkan kelengkapan elektrik ke tempat yang tinggi. Semasa menghadapi banjir, jangan petik suis, sentuh kelengkapan atau kabel elektrik dengan tangan basah. Jangan pegang struktur, tiang atau pagar besi. Jangan hampiri, berenang atau meredah air banjir berdekatan pepasangan elektrik. Jangan alih, baiki, uji talian atas elektrik yang putus atau jatuh ke tanah. Selepas banjir, tutup suis utama sebelum kerja-kerja pembersihan dilakukan. Pastikan kelengkapan elektrik kering sebelum digunakan. Dan lantik kontraktor elektrik berdaftar dengan Suruhanjaya Tenaga.
We're back on Bernama World talking to MEDIHA Mahmood and also Professor Dr. Chan. Now we're talking about suicide reporting. Earlier on we spoke a little bit about the guidelines, but of course implementation is the most important aspect. Now, how will the content forum ensure that these guidelines are widely adopted and also effectively enforced within the industry? Who are the people who will be enforcing these guidelines?
So that's the toughest bit. But for us, at least we have our members, and most of the broadcasters in Malaysia are already our members. And they have helped us build and develop these guidelines, and they have committed to abiding by them. And in the content forum, we also have a complaints bureau. So if there are complaints over the way there's unsafe reporting by any of our members, complaints can be made, it will be assessed, and if it is a breach of the content code, then action can be taken. For the content forum, the extent of the action that can be taken is a compound of up to 50,000 ringgit. But because content forum is a self-regulation, industry self-regulation thing, we are not out there to get people. We feel that punishing isn't something that can change mindsets.
Right.
So what we do is we would have, and we continue to have, advocacy training workshops with media and journalists to make sure that everybody understands the reasons why this is in, and everybody combines the efforts to make sure that they comply. Because the last thing we want is for people to comply and then lose the eyeballs or the clicks to people who don't.
Right.
That's the biggest problem for us, really, because with social media, with the fact that you need clicks and eyeballs to get revenue, and unfortunately, human interest story also include interest in things that they shouldn't be interested in, like the hows and the whys and the suicide notes and stuff like that.
Yeah.
So that is a challenge. But I do have faith in our members. I do have faith in the industry and the media industry as well, that we all want to prevent harm, and this is a way for us to do it.
I'd imagine the biggest challenge, won't be with professional media agencies, but with online media outlets or self-proclaimed journalists, or like you mentioned, content creators and influencers. So how do we regulate? How do we make sure that they comply to these guidelines?
This is where one of the things that we can do is to leverage on the power of our netizens, because that does help. Because if I've realized something that the court of public opinion also helps.
Right.
We have seen situations where certain platforms have content which is harmful, like unethical reporting of suicide, and when we point it out, and the more people who are also online, who are within, let's say if it's Twitter or Facebook, whatever it is, they too say that this is not on, you shouldn't be doing this, you shouldn't be sharing these photos, even if you mosaic it. So that sort of compels them to understand that, okay, this is not acceptable anymore, or at least it's not good for my brand or my reputation, so hopefully they don't do it. Influencers is a different story altogether, and for that I think we will be working with the social media platforms to make them understand as well why we need to have such content off the platforms, because right now there are community guidelines which talk about self-harm and suicide, but the extent of it may not be completely taken in. For example, I think Dr. Chan was also Professor Chan was also the one who let us know that even the little details about location, about methods, even the photos that you use, it may be stock images that you use, even those need to be looked at very carefully, because it can lead to harm.
Speaking of, what you've mentioned, it also does require the general public to have a very high level of awareness when it comes to these kind of issues. Professor Chan, do you see a need for similar ethical guidelines for other sensitive topics? For example, when reporting on mental health crisis in general, because when we talk about suicide, the conversation that happens after is almost always about mental health.
Absolutely. I think that should not be confined to only suicide or suicide prevention. It should encompass the whole of mental health. For example, there is a myth that's being perpetrated that people with mental illness are all violent, and that comes up a lot in press. So that is completely mistaken view to have, because in actual fact only 3 to 5% of violence are actually perpetrated by people with mental illness. And if studies have shown that if you compare people who have been just discharged from the psychiatric ward with a mental illness and people who are general population, in the general population, the risk of actually becoming violent is almost the same, except that if any of these two different groups have substance abuse on top of that, then the substance abuse is a driver behind that. So I think it's absolutely important for all mental health to destigmatize mental health. But I would just like to add a little to what MEDIHA said just now about the content creators and what about the so-called unregulated media. There has been a study that's been done, I think it was the US if not mistaken, and with a Facebook employee of somebody related to Facebook, which showed that if the content or the news or whatever post on Facebook was actually adhering to safe reporting guidelines about suicide, there was actually more reshares and more engagement. So there is evidence that sensationalism doesn't always sell. That's a myth. That's why people sometimes go overboard in trying to make their story spicy and clickbaits and stuff like that. So I just want to highlight that there is evidence that if you report news safely, you might get even more reshares and more engagement, and this serves the dual purpose of suicide prevention as well as the media's role of actually increased engagement.
So earlier you mentioned that the guidelines are open for feedback. Now, these guidelines will be open for public consultation. How can the general public in Malaysia, including mental health professionals and also media practitioners, contribute to refining these guidelines?
Oh, it's already open. So they can head on to our website at contentforum.my. I believe you've also flashed out the QR code to that as well. And we definitely welcome everyone to have a say on this. And this is exactly how we get even more nitty-gritty details to put into the guidelines.
Right.
We also offer to have town halls as well to explain these guidelines in more detail for any groups who would want it. And we're working with pockets of groups as media, journalists, students, academicians, and of course mental health practitioners as well.
Right. Another question. What challenges do you foresee in getting media organizations and influencers to adhere to these guidelines, like we mentioned earlier? And if there are any challenges at all, how do you plan to address them? I mean, you said that, a punitive action may not be the best way to go.
We definitely have to get their buy-in on this. I mean, cyberbullying used to be a thing that nobody really talked about. It happened a lot. People were trolled right and left, but only recently have people seen the harm that it can do to people, and then they're legislating it and taking all sorts of action against it. Similarly, with unethical suicide reporting, we feel that the only way for us to have real, actual, sustainable change is for there to be a mentality shift as well. I think what Professor Chan has highlighted is very clear. If people realize that clickbait on this kind of thing is really not worth it, and everybody just stops doing it eventually, then that's the way to go. So advocacy and awareness is how we're going to play the game.
Right. Prof, looking ahead, what role do you believe education and also media literacy play in ensuring long-term responsible reporting on suicide, but also on mental health issues?
Yep, so I think education and awareness are really key in engaging the media community as well as the wider public to be more aware of safe reporting. So we have actually done a piece of research that showed that if we did a safe media reporting workshop for a group of media practitioners, their knowledge and awareness about what it means to report suicide safely actually increases.
Right.
So if you do it even earlier in their career, even when they are actually students in the universities doing their mass comm degree, that is really important. But I think that it should not be just a touch and go one-off situation. There should be kind of like continuous follow-up and continuous update on what's the newest, what is the most evidence-based way of the narrative of suicide-related content to be shared. And I think I would like to also highlight that the voice of the people with lived experience is of utmost importance.
Right.
And who do I mean by people with lived experience? People who have actually experienced suicidal ideation, attempted suicide and recovered, or people who have lost their loved ones or are bereaved by suicide. Now these are the people who are actually bearing the brunt of all the ill effects of how a suicide story is reported unsafely. So they are in the perfect position to educate all of us, even healthcare practitioners, on what's good and what's not good.
Right. Just to wrap things up towards the end of our show, very quickly, MEDIHA, what are your hopes for media practitioners, both professional and to our social media influencers out there?
I hope everyone out there who knows that they have an influence, whether it be media or influencers, realize the power that they have in changing narratives and saving lives, honestly. It sounds dramatic, but it's true. And take upon this role and responsibility to first find out what we're doing with these guidelines, contribute to it if you can, and once it's out there, please do comply with it. And like Professor Chan says, we continue to do training and workshops, and we will be very happy, and we welcome every opportunity to create more awareness about this.
Right. Prof, also maybe a helpline like you'd like to share with our audience today?
Yeah, so my helpline that's freely accessible is Talian Heal, run by the Ministry of Health Malaysia. It's very simple to remember, 15555. And we've also got Befrienders Kuala Lumpur, which you can just Google it up, and it is available 24/7. So these are the two main guidelines. You can find more guidelines if you type in find a helpline, and they have all the helplines that are available in Malaysia.
And there you have it. Thank you, MEDIHA, and also Prof Chan for joining us today, talking about the very, very important topic of suicide. Suicide is not just a statistic, it is a reflection of the urgent need for responsible reporting and compassion and understanding from us, the general public. As the content farm works to shape ethical guidelines, it's clear that the media and also the public play a vital role in influencing how these stories are told. Now, together, through awareness, sensitivity and ethical reporting, we can help create a society that informs with care and supports with empathy. This has been The World on BERNAMA TV. I'm PASHA RAHIM. Thanks for watching.